Across the United States, flu cases are rising faster than expected, and health officials say this season is unfolding differently than usual. Hospitals are reporting a noticeable increase in flu-related visits, pharmacies are seeing higher demand for medications, and public health experts are closely tracking what appears to be a surprise new virus variant contributing to the spike. For millions of Americans, this raises urgent questions. Why is the flu spreading so quickly? How serious is this surge? And what can you do right now to protect yourself and your family? In this report, we break down the facts, the science, and the steps that matter most, so you can stay informed and prepared during this critical flu season. Nationwide rise in flu activity. Health surveillance data shows flu activity increasing across multiple regions of the country, including the Midwest, Northeast, South, and parts of the West Coast. Emergency departments are experiencing higher than normal patient volumes, particularly among children, older adults, and people with weakened immune systems. Doctors say this flu season is standing out not just because of the number of cases, but because of how early and quickly infections are spreading. While seasonal flu is expected every year, the current surge has prompted additional monitoring from state and federal health agencies. Influenza is not a mild illness for everyone. Each year, it leads to hundreds of thousands of hospitalizations across the U.S., and severe complications can occur when treatment is delayed. The new virus variant factor. Public health experts are now examining the role of a newly identified virus variant that may be contributing to increased transmission. While research is still ongoing, early findings suggest this strain may spread more efficiently from person to person. It's important to understand that a new variant does not automatically mean more severe disease. However, increased transmissibility can lead to more infections overall, especially in communities where immunity levels are lower. Scientists are actively studying how this variant behaves, how well existing vaccines protect against it, and whether symptoms differ from previous strains. So far, health authorities continue to emphasize that current flu vaccines remain highly effective at preventing severe illness, hospitalization, and death. Recognizing flu symptoms. Medical professionals urge Americans to stay alert for flu symptoms, which often appear suddenly. These include fever, chills, persistent coughing, sore throat, muscle aches, headaches, fatigue, and nasal congestion. In some cases, particularly among seniors, young children, and individuals with chronic conditions, symptoms can worsen rapidly. Shortness of breath, chest pain, confusion, or a fever that does not improve are warning signs that require immediate medical attention. Early diagnosis and timely treatment can significantly reduce the risk of complications. Impact on the healthcare system. Hospitals in several states are reporting increased pressure on emergency rooms and inpatient units. Pediatric hospitals, in particular, are seeing a rise in flu-related admissions. Healthcare workers are urging the public not to wait too long before seeking care and to use urgent care or telehealth services when appropriate. These steps help ensure that emergency departments remain available for the most critical cases. Prevention remains the best defense. Health experts are clear. Prevention is still the most powerful tool against the flu. They strongly recommend getting the seasonal flu vaccine, which reduces the risk of severe illness even if infection occurs. Additional preventive measures include frequent hand washing, avoiding close contact with sick individuals, staying home when ill, improving indoor ventilation, and wearing masks in crowded indoor spaces during periods of high flu activity. These simple actions can significantly slow the spread of the virus. What comes next? While flu activity may continue to fluctuate, public health officials say the coming weeks will be critical. Ongoing surveillance will guide recommendations, and Americans are encouraged to stay updated through trusted medical sources. Preparedness, awareness, and early action can make a real difference, not just for individuals, but for entire communities. Flu season is a reminder that public health is a shared responsibility. Staying informed and taking preventive steps protects not only you, but those around you. If you found this report helpful, like the video, subscribe for reliable health updates, and share this information with friends and family. Stay informed, stay cautious, and most importantly, stay healthy.